On Your Side Tonight continues now. Good evening, and thank you so much for staying with us. I'm John Carter. Jamie Bull has the night off. We begin tonight with a sobering thought. Researchers say 22% of North Carolina high school students, nearly a quarter of students, said they seriously considered taking their own lives in the past year. Well, with numbers like that, chances are you know someone who's faced a struggle with mental health like this. Every day, the clock is ticking to help our young people before it's too late. And here in Charlotte, there's soon to be a refuge. HopeWay, which is a joint commission accredited health treatment center for adults, is going to be expanding Hope for mental health and eating disorder treatment for adolescents and young adults with a new location in East Charlotte. Construction is underway on the 18,000 square foot space found at Oakhurst Commons along Monroe Road. The HopeWay team will treat mental health diagnoses in teens and eating disorders in teens and young adults who will attend treatment during the day and return home after programming. More than 2.5 million children in the U.S. have severe major depression. More than 60% of youth with major depression don't receive treatment. Suicide is the second leading cause of death for people ages 10 to 34. Eating disorders among adolescents have doubled since the start of the pandemic. We're told HopeWay has received calls about mental health services for adolescents since the day it opened in 2016. Well, today we spoke with Dr. Allison Karofsky-Mazie. She's a triple-boarded psychiatrist, and she serves as HopeWay's Chief Executive Officer and Chief Medical Officer. We spoke to her today and were reminded the care and programming for adolescents and young adults is both severe and immediate. Really do appreciate you being with us here tonight. This is such an important issue, having experienced it personally myself with family members. So I'm very interested in the fact that you all are looking to do something more with adolescents, younger people. But first of all, tell me exactly what is HopeWay?
So HopeWay is a nonprofit adult mental health treatment facility that we started 7 years ago here in South Charlotte. And we have a whole host of programs for adults struggling with mental health issues, whether it's depression, bipolar disorder, schizophrenia, trauma. And we're very evidence-based and physician-led. We really do a great job combining medication management with individual therapy, group therapy, and a whole host of integrative therapies like yoga, music, mindfulness, and everything you can really stack the deck to get well with.
How significant would you say is the need for mental health services, not only just in Mecklenburg County, but North Carolina and the United States? But start more specifically locally and then expand that.
Sure. So it's a national crisis right now, especially for our youth. So we are thrilled to be expanding our treatment offerings down to teens and adolescents. But in general, 1 in 4 or 1 in 5 folks struggle with mental health issue. These diseases affect all of our families, whether it's brain injury or ADHD or depression or an addiction. The more that we talk about these brain diseases just as a medical issue, the better we're going to be with decreasing stigma. So it's affecting all of our families.
Why is there such a stigma, though? If you break your arm, you go to the doctor. If you break your leg, you go to the doctor. If you have a heart attack, you go to the doctor. If you have a mental illness, you hide it, you don't tell anyone. Well, why is that?
It's so difficult because a lot of these brain diseases have behavioral symptoms, and so you may have difficulty sleeping or trouble eating if you have an eating disorder, or irritability, and so it's a lot more difficult for parents to even understand what's going on with their child, or in many cases for adults to understand that they do have, say, anxiety or mild depressive disorder, because you can still be pretty functioning with some of these disorders. We also don't like to talk about them, but I think we're doing a better job with that.
Why don't we like to talk about them?
I think people are just nervous about the stigma. If you have a child with mental health issues, you don't want to, impede their ability to get a job or to get into a school. The same thing if you're a physician. There's several mental health disorders that affect people in medical school, and nobody wants to talk about that because you don't want to get kicked out of school. So we really need to do a better job at supporting people that are struggling with mental health issues and helping them to reach their potential, because there's police officers, there's lawyers, there's physicians, there's politicians, all living and working with mental health issues, and the more that we can help people and stabilize them, the better society will be for everybody.
Fighting that stigma, that's just one of the many challenges mental health professionals find themselves up against. Now, my conversation with Dr. Karosky-Mazy continued. We discussed some of the biggest obstacles in treating young people. And we also discussed if there's any movement for children to undergo mental health evaluations at younger ages. So here's what I learned. What do you think is the greatest challenge from your perspective in treating young people?
I think the biggest challenge is, folks not wanting or not understanding their disease and not understanding the magnitude of the physical ramifications of, say, an eating disorder, or not having the maturity to understand what exactly is going on if they have bipolar disorder. There's also a really important need for family therapy, so that's going to be integrated into the program, because if you have a child that may need treatment for, say, ADHD, and the parents are against medication that the physician may think is helpful, you have to talk about that, and you have to understand, like, what are the benefits and what are the risks and what side effects might my child experience. And that's a team decision that we need to make, with the family and the child and the doctor. And so the family therapy component will be really big in these programs as well.
Is there any kind of movement whatsoever to say children should be going through mental health evaluations as early as possible?
I think we're doing a better job by training the pediatricians and the primary care physicians and the OBGYN doctors and everyone that's seeing people identify depression, anxiety, substance use disorders, and then triage up the higher level of care. So integrating mental health into primary care is ideal. Because those are the people that are seeing the kids first, right? And so how can we help the pediatrician who's struggling with seeing all these kids that are all struggling right now, is giving them resources. So you're right, prevention and early identification are keys to getting kids well. And so the fact that we're going to be opening for middle school and high school is just awesome, because the earlier we can intervene, we can change the trajectory of these kids' lives for the better. And it gives me goosebumps thinking about this, because I'm just so excited to be able to bring this to Charlotte.
Well, we are glad that you are bringing this to Charlotte. I know this is going to help so many people, and all they got to learn to do is recognize that they need help and they need to reach out. They can contact HopeWay or their pediatrician or their doctor, and hopefully they'll get treatment for so many people who need it. I can talk for hours about this. It's a fascinating subject and something we need to get rid of, this stigma of mental health issues and not being afraid to say, hey, I've got an issue, I need to address it.
Absolutely.
Dr. Allison Karosky-Mazy, thank you so much for being with us. Some great information. Good luck to you.
Thank you.
Now, based on the construction and licensure timeline, HopeWay's new state-of-the-art facility is targeted to open later this fall, 2023. And a reminder, HopeWay's main campus is located along Sharon Road West. Hey, if you'd like to revisit tonight's conversation, I hope you will, because it talks about the importance of discussing and treating mental health even within your own family. You can find our story on our website. Just go to WBTV.com under the tab for On Your Side Tonight.